from South Carolina, and there's a very large lack of knowledge for practitioners there. We are unable to find a physical therapist who even, one, understood the disease or even had heard of it. So we struggled there. We struggled finding a surgeon to do the scapular fixation. So we're dealing with a lack of knowledge with practitioners. I think that is the biggest problem, especially in the South. It's very difficult to travel up here to where all this wonderful knowledge is and partake in that. So if there's any way that knowledge could be spread, that would be wonderful.
Again, when my son was diagnosed and we had a PT eval, the PT said, don't ever lift anything over 5 pounds. So that being said, there's so much, I'm not going to say ignorance, but a lot of doctors and PTs have no idea. And we left that visit and I said, do what you want. Don't, it's use it or lose it. Or if you work too hard, you're going to lose it quicker. There's nothing really definitive right now, is there? About exercise and weight training or how hard to push yourself. I get don't push yourself past exhaustion, but I'm not going to tell my 19-year-old kid don't lift over 5 pounds either.
There is a Cochrane review on exercise in muscle diseases. You can use that. And in the Netherlands, the patient advocacy group sent out mailings and also leaflets for the patients to bring to their doctor and PTs. So, because a lot of PTs think, don't race with a broken car. So with a muscle disease, you do not use your muscles, because in the past, in the MDX mouse, it was shown that training was not beneficial in the MDX mouse. But so I think the best evidence is the Cochrane review on exercise in muscle diseases.
I found it as the difficulty in just getting out of bed. I can get exhausted. You know, just getting into my wheelchair can be exhausting. So, and then the thought of going to a physical therapist or an occupational therapist, their goal was always to get you better. You know, like I was an athlete, an injured athlete that they wanted to heal, and trying to explain that no, I'm trying to find new ways of doing things. I'm not going to heal. I always kept hearing that. I tried physical therapy about 5 times, and there's always that. I felt they were looking at me as an athlete. They wanted to heal, and trying to get that understanding that no, I'm not going to heal. How can I do something differently?
I have also a comment about the exercise. I just think I'm at a roadblock. I'm not sure what modality would be appropriate anymore, because I'm getting different responses to my body. For instance, two particular instances, I was swimming and I use fins for buoyancy and to help me glide through the water easily, which is easier on my upper body. But with drop foot, now I have 2 AFOs, and I'm not sure if the fins are a disadvantage because it just emphasizes the position of drop foot. So that was one reason. In my own mind, I'm just thinking, and no one could answer that as far as my PTs or my personal trainers. And the other thing was, I was cycling, my back was giving me, I was a big cyclist prior to the AFOs, but I don't trust myself clipping in and out of my bike anymore. So I was using a recumbent bike, boring, didn't get the cardiovascular benefit, so I went to the elliptical. Now, there was a knee issue that came up, such that I thought I did something really damaging. I couldn't put any pressure, had an MRI, saw an orthopedist, nothing wrong with the knee, but he can't tell me what is wrong with the knee, but there's constant pain. So I just don't know who to go to and what to do.
I just have a comment on the woman over here who was looking for some place to go for exercise. Well, for the last 10 months, I joined an organization that is just for women, and there's only 4 clients in the studio at a time, And I, for 8 months, had a one-on-one physical therapist with me. I don't know if I can mention the name of the organization or the gym. I will anyway. In Shape for Women. So I joined that for the reason to build up my muscles. So I went from I couldn't even walk on the treadmill. I actually fell on the treadmill the first day it was there. And I was mortified. So I went from not able to walk on the treadmill to walking 31 minutes, 3 times a week. And then I went from lifting, doing elastic bands. I couldn't even do the elastic bands from the rotation of my shoulders to now doing it at 20 rotations on each arm. And that's over a 10-month period. I recently fractured my back, so I haven't been to the gym in 2 months, but I'm anxious to go back. So then I went from lifting only 2-pound weights this way to 8 pounds on each arm. Yeah, so there was a benefit, and now my muscles on my legs are very strong. My back is my weakest, so I do rowing in that gym. So it's 25 minutes muscle strengthening and 25 minutes on the treadmill to 30 minutes. So maybe there is some benefit there.
We have time for a couple more questions, and then we should wrap up. Dr. Emerson?
It's just evident that the relationship between patients, their families, and the therapeutic and research community, that partnership is critical to your daily lives as well as therapeutic development. And I hear all kinds of really interesting, important things coming back in the response to these questions, like what should we do more retinal work? Why don't we have good delivery systems for conveying information to physical therapists? Why don't we have more medical centers? Is there some way that we can, how do you feel you're communicating this information back? Is there a way you guys can organize it in some way, these particular concerns that can be distilled and put forth and in some organized way, so we can not just hear these things, but have you sort of distill this down into some way that we can actually have an action plan to go forward and see if for instance, the society can collate what you're saying in some way that you can agree on as these are the priorities that we need to be thinking about.
Can I elaborate on that a little bit? Because we did such an enterprise in Holland, starting a dialogue. I think this is an excellent start then. And the FSH Society could start a dialogue with patients not only today, but more systematically to identify the themes that are important from not only by patients, but in the dialogue between patients, researchers, and doctors. And based on that, we published this in 2012, the research agenda as a result of a dialogue between patients and doctors. And the result was unexpected, at least by us. So I totally agree with you that this can be a start of a longer duration, and FSH Society can then have also an agenda which is really, I think, unique in the world.
I think for us, we had a different strategies, because I speak on behalf of my husband, and back home there are different issues. There are cost implications, their facilities are not there, and also the infrastructure. Like at one point he decided to be walking, but falling is quite often, so he can't keep on walking, and that is a big challenge for us. Then when we think of doing it at home, the cost implications of getting maybe the treadmills and all that has been a hindrance. And I think also I would also want to share with my sister there that this information is also not well spread to other different nations. It was quite a challenge also coming here, because we needed to get this information, and that is why we decided to sacrifice and come and meet different people and from different nations, and we are so grateful. We also have a question. We were just wondering, with my husband whether there are other hospitals in maybe in Africa or, to be specific, in Kenya where you collaborate with, where maybe we can go and do the testing, because we have a 16-year-old son and a 10-year-old, and we are just wondering if we could get a chance of taking them to be tested so that we can know quite early. Thank you so much.